claiming that working at the facility poses a major risk to them. The strike, which starts on Monday, October 31, is also to push the government to provide the facility with the basic logistics they require to carry out their work effectively. There's a massive shortage of basic logistics needed to carry out professional duties such as gloves, spirit, dressing solutions, face masks, plastic, sterile, cotton and other detergents. This exposes the staff and patients to the unnecessary risk of cross-infections. The nurses said in a release. Chairperson of the nurses, Jamila Hussein, said they have decided to leave the wards as a last resort because the attempt to secure a lasting solution to the problem have run into a brick wall. The psychiatric hospital in September shut down its OPD due to financial challenges.
We've run our services, but the workers are not going to their workplace because the place has become so dangerous for us to work in now. The very things we need to work with are not there, i.e. the medication to calm the patients down, gloves, cotton, spirit. They are not there. Even the food that is given to the patient is low in quality and quantity, and that is also a source of aggression. Even risk allowances in the line of duty, should you be hurt, you don't get anything. I have been hurt 3 times in the line of duty, and I've been taking care of myself. Just last week, a colleague who had 2 previous years was hit in the abdomen, and the incision was ruptured. She has to go back to the theater again. There are other colleagues who were pregnant, who were pushed from behind. They fell with their stomach. They have to be rushed to the theater in the past, and they have a whole lot of complications associated with it. Even somewhere last week, some of our colleagues were hurt. And in all of this, most of the time, the patients have 1 or 2 hallucinations. That's when they start hearing voices, they start saying things. But now that the medications are not there, almost all of them have relapsed. And sometimes you could be in the office working with them, and then about 4, 5, almost about 10 patients would relapse at the same time and all get aggressive. The only option for us is to run to the nurses station and call backup from other wards to come and help us out, which shouldn't be the case. So all we are saying that the place has become so dangerous for us now, as well as for the patient. But in this instance, we are thinking about the staff's protection first and foremost, because our lives are precious. So we don't want to compromise on our lives.
And you were just watching a representative of the psychiatric hospital nurses there talking about their strike and the need for them to go on that strike. You are aware that today they have declared an indefinite strike because of what they describe as poor conditions of service at the facility. And of course, we heard him talking about gloves and some other basic things that they need to do their work, but government is still yet to provide such items for them to work with effectively. Let's move on to another story, also a health-related issue, and health officials in Coast Metropolis are battling with cholera outbreak, which is putting strain on hospital operations. The outbreak, which has been on the increase for about a week now, has tremendously increased turnout of the OPD as the authorities struggle to avert any fatalities. We'll get Richard Kwejo shortly to give us an assessment of this condition, the cholera outbreak in the central region. But let's go to our first story and get an update on it from our correspondent Maxwell Agbagba. He's at the Accra Psychiatric Hospital. Hello, Maxwell. What's the situation there now?
Was kicked in the abdomen by an aggressive patient, and as it stands right now, that particular nurse has been hospitalized at the Rich Hospital. Another information that we are picking up with regards to occupational hazard here at Accra Psychiatric Hospital is also about a psychiatric nurse who had a dislocated shoulder after he was also attacked by an aggressive patient. So all these 2 incidents have triggered the strike action by the psychiatric nurses here at Accra Psychiatric Hospital. Now, if you go to the outpatient department, if you go inside, a lot of the patients are a bit stranded. What we are picking up, and intelligence that we are picking up here, is that the doctors here are locked up in a meeting with the management of the facility. They're locked up in a meeting with the management of the Accra Psychiatric Hospital. And what we are picking up indicates is that indicates that they want to solidarize with the nurses, because as it stands right now, the outpatient department, they need the services of the nurses to be able to carry out effective prescriptions, effective checkups and all of that here at the outpatient department. But because the nurses are embarking on a strike action now, that work is not going to be smooth. So as it stands right now, they want to solidarize with the nurses who are currently on strike. But there's a management meeting that is going to try its best to resolve that matter, to ensure that the doctors do not go on strike. So that meeting will be taking place in some few minutes. But inside the outpatient department, I had interactions with a gentleman who came all the way from Kaswa. He's comfortable with me putting out his name, but let's hold on with that one. He said he came all the way from Kaswa, and we saw the patients that he came to the facility with. That patient has a very serious condition, and he tells me that the complication started sometime this dawn. But they've been here at the outpatient department, and it's been very, very difficult to even access the OPD services because the nurses are currently on strike. So as it stands right now, he is very, very furious and saying that government should do something to mitigate the strike action started by the psychiatric nurses group here at Accra Psychiatric Hospital. So if you go inside the outpatient department, a lot of patients are still stranded there as they are waiting for the doctors to come out from that meeting to be able to serve them. So this is what is happening at Accra Psychiatric Hospital right now. Excited about their conditions of service. They are saying that the gloves that they use in working really is not available. Detergents and other things that they need, other logistics that they need to execute their work successfully have not been put in place, and they don't have all of these things, and it's one of the reasons why they are embarking on this strike action. Philemon, who I spoke to, he's a member of the psychiatric nurses group earlier, told me that there are times when they are compelled to use polythene bags to treat infections and then wounds for patients. It's a sad situation here at Accra Psychiatric Hospital, and as it stands right now, the nurses are not on duty; they are not working. So if you go to the various wards that we have here, the nurses are not present; they are not there taking care of patients. So we have some medical assistants who are currently, few of them who are stationed in some of the wards, who are helping to control the situation. So that's what is happening here at Accra Psychiatric Hospital here in Accra.
Indeed, I can imagine what is happening currently there at the Accra Psychiatric Hospital. But let's stay on health, this time to the central region where there's an outbreak of cholera. And our correspondent, Richard Kwejonyako, has been going from, health centers to check the impact of this outbreak on health facilities, as well as, the health officials there. Kwejonyako joins us live on the line. Hello, Kwejo, if you can hear me, describe to us what you have seen this morning.
Well, this morning I've been to some of the private hospitals, Bingati, Maria Hospital. I've also been to the Cape Coast Metro Hospital and the University of Cape Coast Hospital. What I see is that I see patients being carried in taxis to some of these facilities, and then I can see that the health officials are also busily attending to them, and so their main focus is on these patients because they would want to avert fatalities, and that is what they have instructed the health officials to do. After that one, the taxis are disinfected because they would not want some of the fecal matters in case some of the patients that were brought in the taxi, some of them eat themselves. I mean, they would have to disinfect the taxis. So these are some of the processes that are ongoing in the various hospitals I have visited. At the University of Cape Coast, authorities are really getting very serious with the education on the radio stations there, because according to them, the university has a lot of population, and so they are asking people to be very cautious in how they eat, where they buy food, and other precautionary measures that they have to take. And so these are some of the things that are happening in the health facilities and in the Cape Coast Metropolis.
Kwejonyako, I heard you say that they are working hard to avoid or prevent fatalities. Do I get it to mean that nobody has died from this yet?
Yes, no one has died. In fact, according to the Regional Health Directorate and the Disease Control Unit in the Cape Coast Metropolis, it is the measures that they have adopted. That is why they have recorded no fatalities. But there are a lot of patients that have been attended to that have been attacked by cholera, and so they want residents to really practice sanitary conditions or adopt hygienic practices. Some of these places, they do not have toilets, and so others have resorted to defecating openly. Other places that they even have toilets, people still defecate in the open and at the beaches and the others. So they feel that these are the sources of the contamination that has brought about the uptake in the cases of cholera in the Cape Coast Metropolis.
Thank you very much, Richard Kwejonyako is our correspondent in the Central Region, giving us that update on the latest cholera outbreak in that region and the fact that the health officials there are really working hard to contain the situation. You're still here on News Desk on Joy News on Multi TV, your election headquarters.